when understanding healthy blood pressure and cholesterol, women need to know that a normal blood pressure is any blood pressure which is 130/80 or below. That means top number has to be 130, bottom number has to be 80, and that is the highest number you should always have. If there is any number higher than that, that is high blood pressure. So if your blood pressure is lower than that number, then that's normal. And for cholesterol, your total cholesterol has to be 200 at the most, or less than that. And there's a further breakdown in good and bad cholesterol, which basically, in relation to women, the good cholesterol has to be more than 45 milligrams per deciliter, and bad cholesterol has to be less than 130 milligram per deciliter. If you're diabetic, it has to be less than 100, which is a little bit too much detail for a patient to understand, but these are very easily reproducible numbers and can be searched online. Every woman should know about high blood pressure and cholesterol's effects on your overall health. High blood pressure is a very common disease, which is usually one of those diseases which has very serious consequences but is not symptomatic. It does not really produce any symptoms. So if you're hypertensive, or that means you have high blood pressure, there is no way to know unless you actually check your blood pressure. And it's also good to take a step back and see exactly what is happening when you have high blood pressure. Your heart is beating 80 times per minute in an average human being, and when the heart is beating against that high pressure, it has to work harder. So you can imagine for this heart to beating 80 times a minute against this pressure, which is more than normal. So eventually it will cause your heart to get thicker because it has to generate more force to overcome this pressure and makes your heart muscles thicker. And similarly, that stress is transmitted throughout your vascular system, that is your arteries and your arteries branches and aorta, and which causes slow damage to your body. And that produces a little injury to the lining of the arteries, and which makes those lining of the arteries more susceptible to develop blockage later on. Similarly, cholesterol, which is a normal part of a human constitution, it's a very important substance which exists to develop hormones in our body. We need cholesterol, and our body makes cholesterol. It's not only diet source, but it's made by our liver. But excess amount of cholesterol, especially the distribution of different components of cholesterol, predisposes us to get heart disease. Because if heart artery lining is damaged already from, let's say, blood pressure or smoking or diabetes, cholesterol tends to deposit in those areas and cause the blockages to develop. Or the word plaque is used to describe that blockage. And at some point, that blockage gets narrow enough that it will be short, it'll have a top of it kind of torn by high blood pressure and exposing the underlying lining, causing the blood clot to form. So this process of slow injury and then buildup of cholesterol and then tearing of the cholesterol cap and forming a blood clot is what is slowly leading to a heart attack. So if somebody has a heart attack today, they were injuring their arteries more than 10, 12 years ago. So if somebody was able to go back 12 years ago and correct their blood pressure, correct their cholesterol, this whole progression to injury will be delayed significantly. It may not be completely prevented, but it can be delayed significantly. So that's what our goal is, and that's what a goal of a person who is listening to this now is, to make sure that the blood pressure is normal now, and if it's not normal, to treat it with weight loss, diet change, or medications. Similarly, to the cholesterol is normal. If not, change it with diet, and your modification of exercise program and a medicine if needed, so that you can prevent a long-term damage to your whole vascular system, that is arterial system.